Good day, my dear colleagues. This is Maha Hassan, cardiology specialist at Helwan University. It's a great honor to be with you at the first mentorship program held by Cardiac Academy, which is one of the most unique and special programs at the Egyptian Society of Cardiology. I would like to introduce a short overview about systemic hypertension basics before our class on the next Saturday with more detailed discussion about the guidelines. This is my contact information. First, if we talked about general principles related to blood pressure and hypertension, we know that blood pressure is the force of blood exerts on the inner wall of the great arteries, which transport blood from the heart to all organs. Hypertension is the condition which blood pressure is persistently higher than normal. Blood pressure recorded with two numbers. The higher number, the numerator, is the systolic pressure, and the lower number, the denominator, is the diastolic pressure. Systolic is the pressure that exerted on the arteries when the heart contracts, and diastolic is the pressure exerted when the heart relaxes. Hypertension significantly increases the risk of stroke and heart attack, and one of the most important risk factors for myocardial infarction. Hypertension also increases the risk of heart failure, sudden cardiac death, kidney damage, and peripheral vascular disease. And for every 20 millimeter mercury elevation of the systolic pressure or only 10 millimeter mercury elevation of the diastolic pressure, the risk of death from stroke or heart attack doubles. Both systolic and diastolic hypertension significantly increase the risk of cardiovascular disease. And I believe that diastolic pressure, known as heart pressure, is more significant than systolic is false. Elevated blood pressure is usually asymptomatic until an acute cardiovascular event happened. This is the latest guidelines of the European Society of Cardiology and European Society of Hypertension in 2018, and they classified the office blood pressure to optimal, normal, high normal, grade 1 hypertension, grade 2, grade 3, and isolated systolic hypertension. The optimal category when the systolic blood pressure is below 120 millimeter mercury, and the diastolic when it is below 80 millimeter mercury. On the other hand, the new hypertension classification 2017 by the American Heart Association and American College of Cardiology, they categorize the blood pressure in adults to normal, elevated, stage 1 hypertension, and stage 2. The normal hypertension category when the systolic blood pressure is below 120 millimeter mercury and the diastolic below 80 millimeter mercury, like the optimal category in the European Society of Cardiology classification. This algorithm summarizes the regulation of systemic blood pressure hemodynamics. Blood pressure is the product of cardiac output and total peripheral resistance. The cardiac output is the product of stroke volume and heart rate. Stroke volume is determined by the cardiac contractility, the venous return of the heart, the preload, and the resistance that the left ventricle must overcome to eject the blood into the aorta, which known as the afterload. We see here small arrows in green, which have stimulatory effect on blood pressure as norepinephrine, sympathetic nervous system, aldosterone, antidiuretic hormone that affect the renal retention, angiotensin 2 that consider one of the circulating factor, and alpha 1 receptor in the innervation. The small red arrows has inhibitory effects like the parasympathetic nervous system and atrial natriuretic peptide that decrease the renal retention. There are four systems directly responsible for blood pressure regulation: the heart, the blood vessel tone, the kidney, and the hormones. In the presence of normally functioning kidneys, An increase in blood pressure leads to augmented urine volume and sodium excretion, which returns the blood pressure back to normal. This process known as pressure natriuresis. This process is blunted in hypertensive patients and this leads to elevation of blood pressure. There are two possible reasons for this blunted response: the microvascular and tubule interstitial injury, and the hormonal factor that initiated by the renin-angiotensin system. Allow me here to use this funny comic because I believe that fun learning builds solid information. This picture here explains the renin-angiotensin system work. Normally, when the blood pressure decreases, the kidney releases renin from the juxtaglomerular apparatus. What is the function of this renin? It converts the angiotensinogen to angiotensin 1, which is inactive, this inactive lazy boy. So, the angiotensin 1 can convert and transformed to angiotensin 2, this strong guy, through angiotensin converting enzyme that secretes from the lung. So, what is the function of angiotensin 2, the active strong guy? It acts and increases the blood pressure through two mechanisms. The direct mechanism by vasoconstriction to the vessels, and it also stimulates the adrenal glands to release aldosterone. This aldosterone causes salt and water retention and so on, increase the blood volume and elevate the blood pressure. So, what is the essential hypertension? The majority of hypertensive people have primary hypertension. This means that its cause is unknown. It may be related to hereditary and some other factors like obesity, long-term high sodium intake, lack of physical activity, atherosclerosis, and stiffness of arterial wall. And what about the secondary hypertension? Its causes is exogenous, renal, endocrine, and mechanical causes. This algorithm summarizes the mechanism of organ damage caused by hypertension. Hypertension leads to increased afterload and arterial damage. The high arterial pressure increases the wall tension of the left ventricle, which compensates through hypertrophy without dilatation. Left ventricular hypertrophy results in increased stiffness of the left ventricle with diastolic dysfunction by elevated left ventricular filling pressure. Later on, the increased left ventricular mass may be insufficient to balance the high wall tension and leads to deterioration of contractile capacity and systolic dysfunction and leads to what we know by heart failure. And this is the difference between systolic dysfunction with low ejection fraction and diastolic dysfunction with preserved or normal ejection fraction. Chronic hypertension may lead to development of aneurysm through arterial damage that leads to accelerated atherosclerosis and weakness of the vessel wall. It may lead to aortic dissection also, narrowing of the major arteries and leads to peripheral vascular disease. And here is this picture that showed one of the most important aneurysms, the abdominal aortic aneurysm. The most common cause is the atherosclerosis, and one of the most important risk factors is the hypertension. Chronic hypertension also is a major contributor that leads to development of myocardial ischemia and infarction. This reflects the combination of accelerated coronary atherosclerosis by decreased myocardial oxygen supply and high systolic workload by increased oxygen demand. It can cause also either hemorrhagic or atheroembolic cerebrovascular accidents. On kidney, hypertension induced kidney disease, nephrosclerosis, and renal failure. This occurs through hyaline infiltration of vessel wall and fibrinoid necrosis of capillary wall. on retina. This may lead to hypertensive retinopathy. So, what should we do as a protection and prevention from hypertension, and how to follow up patients with hypertension in general practice? This by regular follow up at least annually, and to measure office and out of office blood pressure, to check the cardiovascular risk profile, and to reinforce recommendations on lifestyle changes. Here we come to the end of our lecture. I hope you find it beneficial, and I will leave you with the next video that summarizes some important definitions as white coat hypertension, isolated systolic and diastolic hypertension, and hypertensive crisis.
To have hypertension or high blood pressure. So that pretty much means it's pretty common. Let's start by defining it. Typically it's represented by two numbers. The top number is the systolic blood pressure, which is the arterial pressure when the heart's contracting. And the lower number is the diastolic blood pressure, which is the arterial pressure when the heart's relaxing or refilling. Most of the time, blood pressure is taken in the brachial artery in your upper arm. Because if the pressure's high there, it's probably high throughout all of the arteries. The guidelines for categorizing blood pressure have recently changed to reflect a growing body of evidence that shows even moderately high blood pressures can significantly increase your risk for developing heart disease. Now, normal systolic blood pressure is defined as less than 120 millimeters of mercury, and a normal diastolic pressure is less than 80 millimeters of mercury. Elevated systolic blood pressure is considered between 120 and 129 millimeters of mercury, and less than 80 millimeters of mercury on the diastolic side. Stage 1 hypertension is between 130 and 139 millimeters of mercury on the systolic side, and between 80 and 89 millimeters of mercury on the diastolic side. Stage 2 hypertension is defined as anything that's 140 millimeters of mercury or higher on the systolic side, and 90 millimeters of mercury or higher on the diastolic side. Typically, both systolic and diastolic pressures tend to climb or fall together, but that's not always the case. Sometimes you can have systolic or diastolic hypertension, when one number's normal and the other's really high. This is referred to as isolated systolic hypertension or isolated diastolic hypertension. High blood pressure is a serious problem for the blood vessels because it causes wear and tear on the endothelial cells that line the inside of the blood vessels. Just like a garden hose that's always under higher pressure, in the long term blood vessels can develop tiny cracks and tears that can lead to serious problems, like myocardial infarctions, aneurysms, and strokes. Now, about 90% of the time, hypertension happens without a clearly identifiable underlying reason. And we call this primary hypertension or essential hypertension. In other words, over time, pressure in the arteries starts to silently creep up. And there are a bunch of risk factors that we've identified for primary hypertension. And these include old age, obesity, salt-heavy diets, and sedentary lifestyles. With the exception of age, all of these can be improved with lifestyle changes. And those changes can help reduce hypertension. About 10% of the time, though, there is a specific, identifiable underlying condition that's the cause of the hypertension, and we call this secondary hypertension. For example, anything that limits the blood flow to the kidneys, or the renal blood flow, can cause hypertension, as well as things like atherosclerosis, vasculitis, or aortic dissection. This is because the kidneys play a super important role in blood pressure regulation. When not enough blood flows to the kidney secretes the hormone renin, which ultimately helps the kidneys retain more water. That water contributes to more blood in the arteries, making them more full, which leads to higher pressures. Other diseases can also cause secondary hypertension. Fibromuscular dysplasia, which affects young women, can cause the walls of the large and medium-sized arteries to thicken. If it involves the renal artery and limits blood flow to the kidneys, it triggers more renin. Another example is a tumor that produces excess aldosterone, and just like renin, this leads to fluid retention. Finally, if the blood pressure gets really high really fast, it's referred to as hypertensive crisis. It involves a systolic pressure greater than 180 millimeters of mercury or a diastolic pressure greater than 120 millimeters of mercury. Hypertensive crisis can be further split into hypertensive urgency and hypertensive emergency. With hypertensive urgency, there hasn't yet been damage to end organs, like the brain, kidneys, heart, and lungs. In hypertensive emergency, there has been shown to be evidence of damage to end organs. So for symptoms, usually primary hypertension isn't actually accompanied by any symptoms, which is why it's sometimes referred to as a silent killer. Secondary hypertension might involve a variety of symptoms associated with the underlying cause. And finally, hypertensive emergency might involve symptoms like confusion, drowsiness, chest pain, and breathlessness. The first choice for treatment of hypertension is lifestyle changes, like changes to the diet, exercise, and stress reduction techniques. In addition, there are a variety of antihypertensive medications that might be given in some cases as well. Alright, as a quick recap. Hypertension, or high blood pressure, affects over 1 billion people around the world, and over time is a major risk factor for heart disease and stroke. Stage 1 hypertension is defined as 130 to 139 millimeters of mercury for the systolic blood pressure, and between 80 to 89 millimeters of mercury for the diastolic pressure. While stage 2 hypertension is defined as greater than 140 millimeters of mercury on the systolic side, and greater than 90 millimeters of mercury on the diastolic side. Hypertension usually doesn't cause any symptoms, and the first line of treatment is lifestyle changes.
Thank you for watching and looking to meet you soon at the Egyptian Society of Cardiology next Saturday. Goodbye.